All parents here in the UK are offered something called a NIPE examination within the first 3 days after birth, which should be repeated by your GP at 6 weeks. This is worth a watch and save in pregnancy, so you understand what's going to be offered to you postpartum with your baby. So the word NIPE means Newborn Infant Physical Examination. It's an acronym for checking your baby over top to toe. Now, what the NIPE is aiming to do is screen for certain conditions. It is not a diagnosis, and I want to make that very clear. So there are some things that might potentially be missed from this because it's a screening examination. If there was a positive test to anything that we did during this assessment, then the aim of that is then to refer on to a paediatrician or an ophthalmologist or cardiologist, for example, so that way what would happen is further diagnostic testing would then happen to then give you a diagnosis. So it's a way of screening so that way we only provide diagnostic testing to those at the highest risk of these conditions. Now, there are 4 main areas of this NIPE examination. We check the eyes, we listen to the heart in various ways and listen to the exact heart sounds that we're hearing. We take the nappy off and we do a hip examination on these babies. And then what we also do is if you have a boy, we are checking the testicles have descended within the scrotum. And the reason for that is because all of these things could potentially mean that if we diagnose them early, they lead on to earlier treatment for some of these conditions that I'm about to go through. Now, what it's also worth noting is that we do a full top to toe check. So we check the head, we'll check behind the ears, we'll check for any birthmarks, we'll check for anything else that we might be able to see. We'll be checking their fingers and their toes, we'll be checking their back, and we'll be checking their reflexes as well. One of those reflexes includes dropping the baby from one hand to the next. And that's a very normal reflex to just check that their startle reflex is working too. So as much as we're only screening for 4 things on the NIPE examination, we actually look at your baby as a whole as well. So why are we doing the NIPE examination, focusing just on those 4 things, but also looking at your baby as a whole? So the first thing I said about was looking at the eyes. So around about 2 to 3 in every 10,000 babies, around about 200 babies a year are born with cataracts. And in over 50% of these, both eyes will be affected. What we're looking for on this is with an ophthalmoscope, so that's the special device that we use to look in your baby's eyes with a light. We're looking for that red eye reflex. And if you had a photo taken before where you have red eyes, that is what we're actually looking for. It's worth noting that it can depend on the ethnicity of the baby as to how bright the red reflex is of the baby. And what we're looking for is a non-red reflex. And if we had one of those, we would refer on to ophthalmologists who would then undertake further diagnostic testing and potentially treatment as well. Early intervention is really key to helping these babies. So next we check the heart. So around about 8 in 1,000 babies are born with some sort of congenital heart defect. Now this ranges from anywhere from 6 to 12 per 1,000 live births in the UK. Now of these 6 to 12 live births, around 15 to 25% of these babies could have something that actually causes morbidity or mortality if it is not picked up early enough. So the reason why your midwife will listen to the exact sounds of your baby's heart and then make a decision as to whether or not she needs to refer on to a paediatrician or a cardiologist after that. Now, this needs to be repeated by your GP at 6 weeks because actually some things can become more apparent as the baby becomes older. And if anything was suspected with the heart, those paediatricians, those cardiologists would do additional diagnostic testing to be able to find out if there's anything that needs to be intervened or something to be monitored as the baby grows. This part of the NIPE screening can be life-saving. Next is the hips. So around about 3 to 5 per 1,000 babies have hip dysplasia. With hip dysplasia, it's really important that early treatment and early diagnosis is really key to long-term outcomes. The earlier that these things are intervened, if there is hip dysplasia, the higher the chance of a baby walking in the future, moving, mobilising, all the rest of that. So the earlier that this is actually diagnosed, the better the treatment outcomes for these babies. So when assessing the hips, your midwife will be looking at the creases in your baby's bum, in your baby's top of their thighs. They'll be looking at the leg length, for example, whether or not the knees are unilateral when they are placed together. And they will be doing something called Ortolani's or Barlow's manoeuvre as well. And what this does is sees whether or not the hip clicks at all or comes out of the hip joint and socket. It's worth noting that any baby with breech will get a hip ultrasound scan at 6 weeks, and anyone who ticks any additional risk factors will also have a hip ultrasound scan just to confirm those findings. It's also really important to note that this is where good health promotion about slings and the position that babies need to be in slings and swaddling comes in too. And the final part of the examination tends to be the testes as part of an IPF screening. And what your midwife will do is check in the scrotum that there are 2 descended testicles. Around 2 to 6% of babies who are male have undescended testes. And around about 1 in 100 of these 2 to 6%, so very small proportion, will have a testes that does stay within the abdominal cavity and does not descend. There can also be other serious consequences if there are any concerns where the testes haven't descended as well. So that's why doing these tests within the first 3 days is really important, because if there is a problem, they'll get referred on to paediatricians and they'll get assessed and get a timely diagnosis and hopefully treatment earlier too. Now, if there are any concerns with any abnormalities, anything that differs from the normal, then a midwife or paediatrician who's doing the NIPE examination will refer on potentially to a more senior paediatrician for assessment and a thorough review. I'm going to share in part 2 the information about craniosynostosis for information for those who are working in healthcare, for student midwives and for general awareness of this condition.